Hello viewers, this is Dr. Madhushri and welcome to the second episode of Indian drugs related to cough. In this episode, I am going to discuss Acalypha Indica. So let us get started. First, we have the controversies regarding the prover of this drug. Dr. N.M. Chaudhary said Dr. P.C. Majumdar of Calcutta was the first prover of these medicines. Dr. S.C. Ghosh, in his Drugs of Hindustan, said Dr. C.F. Tonre was the prover of this drug. He was a French homeopath and made a proving of this drug, and then it became a valuable remedy in our materia medica. Next, we have Dr. M.L. Sarkar, who also conducted the first proving of this medicine. Now let us see the symptoms of this drug one by one. As we all know, it is a very good remedy for hemorrhage. The color of hemorrhage is extremely important in this drug. So it is a specific remedy from hemorrhage, especially from the lungs, but it can be from the other parts of the body as well. If the symptoms correspond, we can definitely use this medicine. And this is mainly indicated in incipient tuberculosis with hard racking type of cough, and there is bloody expectoration. There is arterial hemorrhage, but please remember the next point, which is the most important: no febrile disturbances. This is very important. There is no febrile disturbances. Cough aggravated at night, but hemorrhage is worse in the morning. Remember this point. Cough is worse or more violent or most violent at night, rather I would say. But if you see the hemorrhage, it is worse in the morning. And what is the character of hemorrhage? Bright red blood in the morning and dark and clotted blood in the evening. Very important. I repeat once again. Bright red blood in the morning and dark and clotted blood in the evening. Now, let us compare the hemorrhage of Acalypha Indica with other related drugs one by one. First in the list we have acetic acid. There is a hoarse, hissing respiration in this drug with great debility. And debility, as we all know, is a very prominent feature of the whole acid group. So acetic acid is not an exception to that. There is great debility in this drug. There is difficult breathing. Also remember, please remember, cough on inhalation. Difficult breathing, cough on inhalation. There is rattling in the chest and laborious breathing. Okay. Next, we have phosphorus. This is also a very important remedy for hemorrhage. And overall, if you see phosphorus, it has got a destructive metabolism in the background. It causes irritation and degeneration of the mucous membrane as a whole. So if you see the cough, the whole body tremble when cough. When the patient coughs, the whole body tremble with cough, and that is worse from the least motion. Okay, there is congestion of the lungs. Remember that there is congestion of the lungs. There is pneumonia of the left lower lung. There is a sense of oppression. That is something, oppression means what? Oppression means something, a heavy weight or something, heaviness in the lung, which is preventing the patient from breathing freely. That is oppression. And cough is aggravated, remember, lying on the left side. Okay, it is aggravated lying on the left side. And also the cough is aggravated from warm to cold room, or when the patient moves from warm room to cold room, that is towards cold or towards coldness, the cough gets aggravated, and this symptom is exactly opposite of what we have seen in case of bryonia. So in case of bryonia, the cough is aggravated from cold to warmth, whereas in case of phosphorus, the cough is aggravated from warm to cold. Also, if you see phosphorus, there is a sense of rawness, there is a sense of dryness, and also there is a sense of roughness. Obviously, if the surface is dry, then eventually it will become rough. So, there is a sense of sensation of rawness in the larynx, dryness, roughness in the larynx. Okay. Next, we have Kali nitricum. This has got dry morning cough. Remember the time of cough, it's mainly morning, dry morning cough with pain in the chest and bloody expectoration. The smell of the expectoration is very characteristic in calinitricum, that is shower smelling expectoration. An expectoration of clotted blood after the patient expels the mucus or tries to expel the mucus. There is clotted blood that is seen in the expectoration. There is asthma. In calinitricum, asthma is a very prominent symptom, and along with that, remember a triad. There is excessive dyspnea, difficulty in breathing. There is nausea, point number 2, and point number 3, there are dull stitches and burning in the chest. So 3 points that you should remember. Along with asthma, calinitricum has got a triad. What is the triad? Asthma with excessive dyspnea, with nausea, with dull stitches and burning in the chest. And all of these drugs have similar type of hemorrhage like Acalypha indica, bright red blood. And the fourth one is most important, that is millefolium. In case of millefolium, you may get a history of injury or wound, like fall from a height, some sprain, overlifting. Actually, what happens, the capillaries of the lungs, nose, etc. are affected, and that is how there is bleeding. Okay, there is profuse bleeding in millefolium. Painless bleeding is there. Okay, profuse painless bleeding is there because the blood is coming from the capillaries. After there is a history, patient is facing all this problem, history of injury or overlifting or any kind of injury maybe. Okay, along with that, there is a difficult breathing, very difficult breathing rather, with tetanic spasm. You may also get another history, that is suppressed menses or hemorrhoids. So this is how these 4 drugs are similar to Acalypha indica with the character of blood and all, but the differences and how they are different from the other drugs from one another, that also I have discussed. So today we are at the end of this episode, and thank you so much for watching till the end. So do like, share and subscribe if you like the video. Thank you.